Hello everyone, I'm Maria Rodriguez with Kaweah Health. Welcome and thank you for joining us on this special live broadcast. As COVID-19 cases continue to surge in California, the state has mandated that hospitals modify their visitor guidelines starting tomorrow, August 11th. With the changes taking effect in less than 24 hours, we want to make sure that you, the community, is well informed so that you can share this information with others. We understand how important our visitors are for our patients' well-being at Kaweah Health, so we want to make sure that this informative session is something that you can use to inform others, and if you have any questions, please be sure to ask them. Now, we have with us today our Chief Nursing Officer for Kaweah Health, Keri Noeske, which she will be talking about the changes that are happening in the hospital starting tomorrow, as the state has ordered us to start implementing these changes for visitors. Keri?
Hi, thank you, Maria. I appreciate the introduction, and I am grateful to be able to be here with you all today just to talk through these visitor changes that we are experiencing again, and to give you all a little bit of background on why this executive order from the state has come through and what it means for our community as we take care of your loved ones here at Kaweah Health. So the state mandate came out last Thursday, August 5th. It was an executive order from the state public health officer and the governor, and it was in response to our continued rise in COVID-19 cases in the state and the concern for the patients and the healthcare staff here at hospitals and other healthcare organizations throughout the state. So this visitor change and this state mandate applies to acute care hospitals like our Kaweah Health. It also applies to skilled nursing facilities, so the skilled nursing facilities in our area, as well as our programs here on Acres and on Court Street. And then it also applies throughout the state to intermediate care facilities. That'd be something like our subacute program that we have over on Court Street as well. This also applies to our patients in our rehab hospital, because that is also an acute care setting. And what this means is, what the mandate really is that visitors for adult patients need to have either proof of vaccination, proof of identification to match that vaccination card, and or proof of a negative COVID test in the last 72 hours. So not and or, just or. It can be proof of vaccination or proof of a negative COVID-19 test 72 hours prior to the time that you want to visit. This state mandate is coming at a time when there are quickly rising numbers, and we have the resources to put in place either vaccinations or testing for our community, and using those resources to just increase the safety of the patients and the staff in healthcare facilities. So what this looks like here for us is as visitors come into the healthcare facilities, we will have our routine screening. We will still be screening for temperature and symptoms like we have been throughout this whole pandemic. But we'll also be asking the visitor to show us their vaccine card every time they come in, or their negative COVID test every time they come in. And really, this is a mandate from the state that we see the evidence, and then we just have to document that the person who came in demonstrated that. We don't need to take copies of your information. We won't be copying it. We won't be filing it anywhere. We will just be documenting that we did check and confirm that you had those items, and then you keep them in your possession. We don't take them, we don't log them anywhere. That's your own personal information. We just have to validate that you do have it. And then for every visit, we will ask that you show that again, and that really just helps us with those resources, and that so we don't have to do more tracking of your information in a system than in the moment when you are there and you're coming to visit. We are going back to one unique visitor, one unique healthy visitor for a patient's entire stay. If you remember, we did this last fall when we reinstated visitors. We started out with just one visitor for a patient while they were here. And we are going back to that to also, again, decrease the burden of checking the vaccinations and or the testing status of multiple individuals in a day. We, like most of the country, have a shortage of team members as there's just been a big change in healthcare team makeups and what people are doing. We don't have enough resources to really do multiple checks in a day. What you can expect when you come in after you show your vaccine or test card is that we will have a band that you'll receive, and then that band then demonstrates that you've been checked for the day or for the 3 days, and we'll be able to use that band to help facilitate faster movement through the process for you. This will not apply. We will not be requiring checking of the vaccination status or your COVID test status if you are accompanying somebody into the emergency department. We will still have one visitor with our emergency department patients, and that will apply mostly when a patient is back in a room because of limited space in our waiting room and our high volumes of patients in the emergency department right now. But you will not need to have a vaccine card or a test for those visits. That is actually an outpatient type visit. Same thing with our outpatient clinics. If you are accompanying somebody or if you need someone to accompany you to a doctor's appointment or to a therapy appointment or any kind of clinic appointment, an outpatient appointment, your visitor does not need to demonstrate vaccination or testing status for those areas. The incidence of and chance of outbreak and interactions and the need to be in close with people is less in those areas, and the state has not mandated that be part of the process for our clinics and outpatient areas. So those will continue as is. We are trying to encourage people to come to appointments on their own if they can, just to help keep volumes down in all these spaces. We have seen quite a few outbreaks. We have seen an increase in patients with COVID. We've seen increased positivity in our clinics when people come in and get tested. So we are seeing that this new variant, this Delta variant that is very present in our community, is causing faster spread. And because our community is about, I believe, 37 to 40% vaccinated right now, we still have a high percentage of people in our community that are unvaccinated, and that puts them at higher risk if they do contract COVID for needing to be hospitalized. Those people that are vaccinated, if they contract COVID, we are seeing pretty routinely that their symptoms are mild. They're able to stay at home and quarantine, maybe a couple of days of mild to moderate symptoms, but not the need for hospitalization. All these factors have played into the reason this state mandate has come to us to really help to decrease the spread and ensure that patients and healthcare workers, if they do have people around them, we know a little more definitively that they're either vaccinated and not at as much risk, or they have a negative test. Excuse me.
And Keri, we want to clarify. You're fine.
Yep.
We want to clarify that the COVID-19 test must be 72 hours prior to the visit.
Yes, I mean it could within 72 hours. So it could be an hour or two, the results from before your visit, but it can't be more than 72 hours before that time. So be really conscientious to that. And we're really trying to give as many of you a heads up information, and even more of you to share with each other and post questions too if you have questions about the things I'm saying or need clarification, so we can respond to those. The more we can get in front of this and get you information ahead of time, the easier it is for you if you do have to come to the hospital, or if your neighbor or another family member is in this situation, you can really help guide them. And we really need to use all avenues possible to get this out there because it did happen so quick. A couple of things that we're waiting for. We're waiting for some clarification. We have pediatric patients here, and we know that parents need to be with pediatric patients. We will ask parents if they have had the COVID vaccine and ask them to demonstrate it, but we're actually seeking some clarification on pediatric patients and visitors, because I don't believe we define a parent of a pediatric patient really as a visitor. So we will have some more to come on that, and we're setting up different avenues to help support parents and of our pediatric and NICU patients in help remaining compliant with this state mandate. Our other area that we're seeking clarification on and looking to put some different processes in place is our labor and delivery area, where we have maybe unforeseen timing of a baby being born. That's not something that's easy to plan. Many of us know, and it's very hard to when you're trying in those final weeks of pregnancy for your partner or your person that you have accompanying you into the hospital to have to try to get tested every 3 days. That's quite the burden. So again, we are trying to clarify with the state if there is any other opportunities there. But for the labor and delivery areas, what we will do is offer testing for the visitor here if they don't have a COVID vaccine documentation. We will support our labor and delivery patients and their support person with testing in the unit, so that we can keep you involved in that birth process.
Now, if there's no other questions on social media, I want you just to talk about, as a nurse, reassurance of the fact that there's ongoing changes, but we always want to put the safety of our patients and our staff as a priority.
Yeah, that's a really good point, Maria, and important to note. I think we maybe take it for granted, but what has come first throughout this whole pandemic? It's been a year and a half now that we have been making decisions and having to make changes and put things in place. At the heart of each of those decisions always is the safety of our patients and the safety of our team members. We need our team members healthy to take care of all the patients that we have that come into our healthcare system, including our patients with COVID. And we also want to be conscientious that we are containing COVID and helping to fight this pandemic and get us back to a sense of normalcy. So our team, the nursing, the therapists, our clinics, everybody is focused on what do our patients need and how do we keep them safe. And these visitor restrictions, while adding significant work on both the part of the visitors and the healthcare system, are important in ensuring safety with what we have available. A question that I've seen is, well, why did we not need to do this a year ago when we have to do it now? If we'd had the resources a year ago to test every visitor, it's something we likely would have explored. It could have helped the visitors know their status. It would have helped us with even more protection for our patients and our staff. We just didn't have the resources a year ago for testing that we do now. We're choosing to continue to allow visitors into the hospital and the skilled nursing facilities, because we really feel that the visitors and family members of our patients help in their healing. They help in the communication, they help in the decision making. And it was difficult last year when the mandate was no visitors at all, and we had to follow that piece and that recommendation from the state for no visitors at all. And we made that decision because we didn't have ways that we could ensure the safety and test people, and there wasn't the vaccine then. We have those now, and we feel comfortable continuing to allow visitors, and having this measure in place really is just a protection, again, for the patients and for the healthcare team in general.
Thanks, Keri. Now, we had a couple of questions come in on social media. One of our viewers is asking, will the state's QR code work for verification, or does it need to be a hard copy? Oh,
that QR code is perfect. Absolutely. And really, that's a great question. If you have a picture on your phone of your card at home and you show us that works too. It doesn't, I don't have to see the physical card. I can see a scanned copy. I can see a picture. You can be FaceTiming with someone at home, and I can see it on there. Yeah, and the QR code, that's ideal because then you always have it. So if you haven't been able to, if you're vaccinated and haven't been able to see that, use that QR code from the state yet, it's pretty slick and it is nice to just have right there.
Another question that came through is somebody asks, being that there are vaccinated breakthrough cases, will you also be testing vaccinated visitors as well?
So we won't be testing vaccinated visitors, though that is the case. What we will continue to do is treat everybody that comes in like they could potentially have it. And we will be practicing social distancing. We will be mandating masking, which is never changed in our patient care areas, and the wiping of surfaces and cleaning of surfaces. All those things are still in place or will be in place, like with the distancing. So all visitors, we will ask when they are in the patient room to, unless you live with that person or a caregiver for that person, for the patient, try to distance as much as you can in the room, as well as distance from the healthcare workers as they do come in the room, and mind that 6 feet of space just to help with that too.
Perfect. Now, one more question. Are outpatients allowed to have someone with them?
So yes, an outpatient can have someone with them, but but like I said, I absolutely encourage you to limit that if you can. But if you need to be with them, especially because of communication, talking with like the doctors or the providers, and just keeping track of what's going on, or you're a caregiver, then yes, you can definitely accompany a patient.
Perfect. Well, we thank all of our viewers for joining us here today. If there are any unanswered questions, we will go back and answer them. Do you have any last words for our community? And
you know, thank you all for tuning in. Thank you for watching this. Thank you for all the support. I look at the social media page often, and most of my team does as well. And your comments, the things that you put on there, the supportive encouragement, the prayers, the gratitude, that goes a long way for our teams, and we really do appreciate that. So thank you for all those kind messages. And please don't be afraid to ask a question. Our team is watching that. I'm usually watching too, and I'll typically send them an answer so that way they can respond as quickly as possible, because we know that the most important thing in this pandemic is the communication of accurate information. We have nothing to gain from feeding inaccurate information. So everything that we share with you is right from scientific sources. It's based on things that we're seeing here, things that we're experiencing ourselves. And we want to make sure you have all that information too, because we know there's a lot of information out there. So thank you for listening and tuning in and letting us be a source of information for you.